Welcome back. We're going to move a little bit forward. No crazy pictures today. But I want to look at traditional or Western medicine, and then it's been compared or counterparted um, to Eastern medicine, and what does that really mean? How does that work? So Western medicine, couple of examples, but the one that comes to mind from the human side quite often because it's very prevalent is diabetes, and there are two types. Most often we're concerned with type 2 because that's the one that we see most often in older individuals, and it has lots of other comorbidities or things that can be related to it on the getting worse side, and also some things that play into getting diabetes. So from a Western medicine standpoint, you look at disease as an entity where you're healthy until you have disease. Once you have disease, this is machine medicine, fix the machine, you get treatment. The treatment for diabetes, I know there are other optional treatments in people that you can use. You'll see commercials for many types of things that you can do in addition, but by far and large, insulin therapy is prescribed. So that is kind of the short Western medicine phenomenon. You have a disease entity, you find out what the cause of the disease is, and you want to then treat the disease. Causing this disease is that your body's not responding to glucose the way it should. You have insulin resistance, so we give more insulin to treat it. If you look at things from the Eastern medicine standpoint, they will inherently look at disease as a overall, looking at the body as the whole. So we have the whole body, and the disease is one part that, and that may in and of itself represent an imbalance. So remember, they always have this kind of a balance mechanism. Lots of terms are balance versus imbalance, and that may be balance of hormone, this key, which is energy, and that does actually float back to the cellular level. Energy, cellular level, the whole system, channels, channels like your acupuncture channels, and flow is something blocking the flow of energy and things like that. Now, many times these two get combated against each other, and you have the traditionalists that say preventative medicine, we should still vaccinate you so that you don't get disease. And then some of these guys on this side, which kind of have clouded it to where you'll get many that will go, well, that's kind of the wacko treatments where people are undergoing hyperbaric oxygen chambers for cancer, which we know doesn't work, and there are some potential bad actors over here, which you have to kind of weed those out. But all in all, if you were to look at your whole body's nutrition, meditation, things that can reduce your overall body stress and can improve your sleep and the quality of your sleep, chiropractic, acupuncture, and then one thing that we use here is it's really PBM, but we call it laser therapy because that's easier to treat. That actually takes on a lot of these types of characteristics. So it would really be considered in this area, although there are a number of these treatments that are now becoming a little bit more mainstream, so they're not quite as out here as like there's some of these wild things like high level vitamin C infusions. There are a lot of things that are very weird, and they're a little bit kind of circling the Pluto area. So we have to figure out which ones are more into the that are floating more into this, well, it's not quite as crazy. And we know that if you match the correct nutrition and you do decrease your stress and you have good body mass index and you exercise, if you look at individuals that do this in combination with some of what was always considered more of whole body treatment, that these guys here that marry the two together, there are a couple of terms in human medicine. Functional medicine is one. There are some that still will say that there's some some crazy things that go on under and within this, but you have to kind of take everything with a grain of salt. But basically, that's looking at taking the two sides and instead of making them completely combative, but blending them together to achieve optimal individual results. So if you look at this one individual and let's say their body mass index is too high and you begin to try to get that where it should be, that if you do that properly, then you will maximize it by individually looking at what can help on both sides. You get optimal health. So that's the whole thought and the whole process along the way. So I clean screen off a little bit here, but let's look at one individual. Again, we're using kind of the human side. I was watching literally, I think it was 2 TV shows back to back, so maybe an hour. And I just wrote these down based off of the commercials that are driven directly to us through our TV screens, and we had diabetes, and many times these can actually occur in the same individual. How about thinking about it that way? So there's a commercial for how you can improve your diabetes treatment. Let's see, we had fibromyalgia. We had one for migraine treatment. There was one for psoriasis. I don't know if I spelled that right. Or eczema. Okay. And each one of these, so diabetes, it was alternative to insulin, but it was something that you would give as a weekly injection to kind of maximize it basically makes your insulin work better. So it's insulin that helps insulin or something along those lines. Fibromyalgia, and certain other types of, there was another one too, but basically they were touting a medicine called Lyrica, which is what's treated just for that. Migraines, this was, I forgot what the name of the tablet was, but it was some pill, maybe it was Excedrin, or Excedrin PM or something like that. There's also something to help you sleep, so there's a sleep aid treatment in here to help you sleep better. Psoriasis, that was the Humira, one of those treatments. And eczema, the same kind of thing. So traditionally, you have this, we'll give you that. You have this, we'll give you that. You have this. Well, what if you have a person who's got like multiple of these? So one of the things that's interesting is that when you look at each of these processes, even cancer, to a degree, certain types of cancers, most of them, underlying, what is the underpinning that feeds each of these? And if you look, it's inflammation. Each of these has a chronic inflammatory process, or a process of inflammation. So it's a chronic, insidious, unnecessary, or beyond necessary response of inflammation. So this is more of an autoimmune type of problem. In diabetes, we know that you have obesity, and that creates this whole organ around a whole fatty organ around the internal organs, which has been shown to have an increase in inflammation, which then drives the type 2 diabetes. Psoriasis and eczema, I mean, they're inflammatory from the very nature of them. And then psoriatic arthritis, part of this whole scenario, that is also bound in inflammation. So what are the chances if we were able to, at a cellular level, now we're not saying that you would not take insulin or you would not take Lyric or you would not do these things, but if there were some things that we could do at a cellular level that would combat inflammation across the board, would we potentially be able to drop out some of this, reduce some of it, or improve how each of these therapies could help these individuals to optimize results? So nutritionally, maybe supplements, something along those lines to engage the cells, improve cellular function, improve cellular handling of inflammation, improve the way that the cells deal with antioxidant, improving antioxidants, naturally helping the antioxidant properties that the cells are naturally producing. If there are ways to do that, which I can tell you there are, we see it. Again, I'm going to go back to laser therapy. We see that. But there is an area in human medicine and functional medicine. If you look up the Cleveland Clinic, for example, the Cleveland Clinic has a functional medicine area. As Dr. Hyman leads it. And I think there is well, last I heard, because I listened to some of his podcasts, as a side note, if you have anyone who takes statins in your family, just Google up Dr. Mark Hyman and find his podcast with a cardiologist from the UK. I think it was a couple of podcasts back. You can find it. It's about cholesterol and cardiac disease, and I would not tell you to not take a medicine that your doctor is having you take, but I would tell you to listen to that just to give a perspective on it, and to let you know you should be doing or be aware of some things that those medicines will affect, including your muscle strength. It's a big deal with how they affect the way your muscles work. So anyway, that's out there in case you're interested. I thought it was extremely interesting from the human side of things. But I'm gonna grab one other photo here. So I'll clear this off. Just give me just a second. Cleared off here. So I wanted to show you these things as we talk about inflammation. Harvard Health Publishing. This is from Harvard Medical School. See if I can make this one a little bit bigger. There we go. Inflammation, a unifying theory of disease. Okay. This is 2006, so this is actually a while ago. And when you get down here, it's there may never be such a single path. Mounting evidence suggests a common underlying cause of major degenerative diseases, the four horsemen in the medical apocalypse: coronary artery disease, diabetes, cancer, and Alzheimer's may be all riding the same steed. So all the four horsemen are riding the same horse, and that horse is inflammation. Research has created a shift in the medical thinking. For 2 millennia, it has been viewed as mainly a necessary, even beneficial process. Inflammation in the short term, if you have a disease, if you get a fever, if you have a bug in your system, the inflammatory response is supposed to help you clear and cure it. It sends white blood cells and your immune system mediators to go clear and get rid of an acute problem. And it is necessary for that. We learned that in all medical schools. However, both now observational and laboratory research are indicating that inflammation can be more of a problem than it is a help, and is a causative factor in many diseases. Now, I think what they're saying there is that a short-term inflammatory response that is appropriate and necessary in the way that the body was designed back when we were the Ferrari is always been considered to be beneficial. However, as we've moved along the pathway, so we've increased longevity, we have humans and animals living longer than they've ever lived before, that our cellular level responses are no longer the Ferrari. They can't go from 0 to 60 as fast as they used to, and they're getting things mucked up along the way. We're getting clogged up with oxidative processes, and a lot of the signals are becoming muddied. So we get an inflammatory process which becomes chronic and insidious and not the same process that was designed to occur originally. And that's when we get here. That is a low-grade inflammation, sometimes riding under the radar screen, that's chronically causing cellular level changes to the detriment of how we're going to stay vital as we're able to live longer. You don't want to live longer being drug across the finish line. You want to be able to be vital through it. So this is from British Journal of Nutrition, and it's a little newer. I think it's 2014. So in this, we're actually saying that the importance of chronic low-grade inflammation, unresolved inflammatory response is likely to be involved. So that means that your inflammation occurred, but it never finished its job, and it's kept hanging around. We've seen this in heartworm disease in dogs. They have a parasite that gets in their system. The inflammatory response starts to try to get rid of the parasite, but they're the natural host, so the parasite can live through it, and it creates a chronic war in the body, that the inflammatory process over time produces the shrapnel from the war, which then seeds and injures the kidneys and everything else. We have a great model in dogs of chronic inflammatory disease. I have a patient right now with a severe ongoing respiratory inflammatory process that we're trying to figure out the best way to treat him, and this is 5 years after he is heartworm negative. But everything got set up by that initial inflammatory response, which just continues to smolder. So potential novel kinetic and integrated approaches to capture the inflammatory status in humans are discussed in the paper. So basically they're saying, yes, there is agreement, but we don't know how to characterize it. We don't have the best test to look at each individual to say, where are you on the inflammatory scale? We know that it's playing a role, and there's lots of stuff that we should be considering to do about it. So down at the end of the article, we're not going to go through, this isn't a journal club, but as you look through these, there's more and more and more of these. These just help us make some sense of it. Is that elevated, unresolved chronic inflammation is a core perturbation in a range of chronic diseases. In other words, that's playing a role in a ton of chronic range of chronic diseases that is an important determinant of the pathological impact. Well, excess adiposity is just fat within the cells, but unresolved chronic inflammation is playing a role in a lot of these diseases. This approach will allow for identification of population subgroups that may particularly benefit from interventions of that target inflammation. So intervening in the inflammatory process is likely to be helpful. What they're saying above is that between foods or supplements, like they haven't got to the point to figure out exactly who should get what, but it looks like we need to learn more about this. The focus of the establishment of a robust diet inflammatory health association is justifiable. There is justifiable evidence to look at ways to control inflammation because there is considering a substantial role of low-grade inflammation in the pathology of numerous chronic diseases, making it a key in future preventative and therapeutic target. So the target should be on the back of inflammation. And what can we do to decrease inflammation? If we're able to do that, we're going to play a role in all of these disease entities. Now let's bring that back to our patients, because when we look at people, we're talking about these types of things. Inflammation plays a role in cancer, cardiovascular disease. Matter of fact, that's why you're going to get a colonoscopy at 50, is because if they catch things that are polyps, they just remove them, because if they sit there, that's a chronic area of inflammatory response. The polyps can become cancerous. And then you get colorectal cancer, and that's a whole other scenario. Alzheimer's disease, pulmonary diseases, Arthritis makes sense, whether it's rheumatoid or autoimmune arthritis, or osteoarthritis, which is aging degenerative arthritis. Neurological diseases, which fits with the opposite of, it's on the opposite side of Alzheimer's, but that's other neurological diseases. Diabetes, autoimmune diseases. So inflammation is at the core in the center. So I just want you to think about all the processes that you have this, we're going to treat this. You got that, we'll treat that. You got that, we'll treat that. You got that, we'll treat that. I'm saying that, yes, you should do that, but don't lose sight of the fact that if we treat, and if there are ways that we can optimize the reduction of inflammation altogether, we will help everything else in our aging population. Now, we see diabetes in dogs, we see neurological conditions in dogs and cats, we see autoimmune, we see arthritis a lot. Alzheimer's, we don't have that in dogs, we don't call it that, but there is an aging process where we get something called cognitive dysfunction in dogs, and that's pretty similar. So the 15-year-old dog, often very older, that will kind of stare off into space. Cardiovascular, absolutely. We have mitral valve disease, everything. So this is a human model, but it all falls in the same category. I think time is running out on the human side because you have an age group, probably where I am, in the mid-40s plus to somewhere around 60, that if you take action here, it's going to fold into how you live your life and how vital you are down here in that 60 to 80 group, age years plus. You can get kind of lucky up in, before 40, 35, up in this category. You can get away with a lot of stuff. You're still driving the Ferrari, but the rust is starting to come in here. And if we can keep the rust away, we're going to do better here. Now, how does that compare out to our patients? I think we're in a much higher need of concern for my patients because their window gets very crunched, and this zone really that I need to see patients is between about 5 and 10 years of age, maybe 9. Does that mean we can't do something for you at 4 if you're a little early, or 11 if you're interested? No, but I think this is our zone you have to work in. So look how much more crunched that gets for our patients. So the next thing that I have is just a short sample of 2 of our patients and how laser therapy does this. And then we have some other modalities that are different than laser, which is what my 30 that I'm getting in my group, what we're going to explore and what we're going to show, and we're actually going to have results. We're going to track. That's why I can only do 30, along with some other reasons, which I'll get into in that nuts and bolts section, which is how to enroll below. But the next thing, I'm just going to show you what we are seeing when we do treat inflammation at the cellular level with an arthritis patient that we have, and with an acute inflammatory process that we had, just 2 patients, and how laser works at the cellular level. Certainly there are other things that I am very interested in that we'll present to those guys that enroll in the program, and we'll follow up. I'll Facebook post or something as we get through our 6 and 12 week points with our guys that get in there. So due to this area right here, I think we've really got a specific zone that we can do some really good things to help maximize the quality of the life as we get into this longevity area right here. How do we make this as good as possible? And that's what I think our goal is going to be. We've kind of figured out how to get you to live a long time, right? Don't get hit by the car, right, if you're the dog. All that kind of stuff. I think the challenge that we're running into now that I'm very interested in is reducing this inflammatory process and maximizing the benefits of this longevity that we're getting. So we're getting the the longevity. Now we want the quality that's in there. Okay, so I hope that gives you a couple more little things to think about, and shoot over to see the how laser works and laser at a cellular level. I don't know what I'll name it yet, but it'll be pretty clear. You'll see us using a laser on one of our patients. So we'll see you over there. Thank you.